Grüezi ragazzi, willkommen and bienvenue to another of our LinkedIn Live. Here this Tuesday we have a very important subject. We have been taking care of talking of veterinary medicine and cannabis over with Cannabiscienza, the Italian sister company of Cannabiscienza, over in the past years. It even involved veterinarians actually to follow a master for veterinary medicine in cannabis because as anyone that has been following as well our last seminar on the endocannabinoid system, unless you are an insect, you will be very much impacted by cannabinoids and anything that can modulate somehow the endocannabinoid system. So today, for this live, I have a great pleasure and honor actually to have here with us Gary Richter, and thank you and welcome.
Thank you.
He's the Hi. He is the co-founder of Vet Cannabis Society, and this is just a short way of introducing him, saying that he's a veterinarian with extensive knowledge on the topic. Because actually, when I've been told by the other guest that we have here today, Heidi Whitman, thank you for rejoining you, and some of you maybe remember her as well on this topic with Dr. Elena Battaglia. So again, talking of veterinary medicine, when she told me that she would join with Dr. Richter, I had a flash memory of him in a stage on 2017 in Sydney that is actually presenting his book that was just released at the time, already teaching other veterinarians how to use cannabinoids in for pet medicine. And that at the time was called the Ultimate Pet Guide. Now, a few years later, along the line, he's still pioneering, and it's about to release another couple of books, one for longevity for cats and the other one on longevity of dogs. So perhaps if you also can spare a couple of minutes on that at some point, since we have quite a lot of questions today, it would be really nice. But welcome to both of you. And also we have Fabio, our CSO, that will conduce the more sciencey interview. So thank you, everyone.
Thank you.
Thank you so much.
So welcome everybody, also from my side. It's really a pleasure today to have Gary Richter and Heidi Whitman talking about the research and application of medical cannabis in veterinary medicine. You know that as the use of medical cannabis expand in human healthcare, it also sparked interest in its potential benefits for our animal. So before going on with the question, I would like to ask both of you a larger introduction of your role in veterinary medicine in the USA for you, Gary, and in the UK for you, Heidi. So please, Gary, maybe you can start.
Sure. Well, hi, everybody. It's very, very wonderful to be here. I appreciate being invited. So my name is Gary Richter. I am a veterinarian in the United States in the San Francisco Bay Area. I've been a veterinarian for about 25 years, and my practice is very focused on what we would call integrative medicine. So we practice both Western medicine as well as more natural holistic medicine, acupuncture, chiropractic, herbal therapy, etc. And for about the past 8 or 9 years, I've really been looking into and researching and using cannabis medicines in my practice because, for me, I'm always looking for what else is out there that I can use to help my patients, particularly the patients that are not improving in any other way. And as many people may know, California really led the way as far as medical cannabis use for people. So it was sort of a very natural progression, in my world, for us to get to that place with animals. And, it started out with me really just doing a lot of personal research into like why was cannabis even a medicine for use in people and potentially in animals. And ultimately I learned about the endocannabinoid system, and then all of a sudden everything made sense as to why these things actually do what they do. And then I started using cannabis medicines in my patients, and I was absolutely amazed at the results. And I'm somebody that I have a lot of training in herbal medicine. I use a lot of herbs in my practice, and I have never experienced any medicine, whether it's a natural medicine or a pharmaceutical, that is as broadly effective and when used properly, as safe as cannabis can be. So I've had great experience with it, with using it in my patients for anything ranging from pain, arthritis, seizures, anxiety, gastrointestinal upset, palliative care for cancer patients, any number of things. Along the lines during that time, I became very involved in the sort of advocacy and legislative side of the use of cannabis in California, because we had some regulations in the state that were making it difficult for veterinarians to become educated and be able to use these products. And as important as the medicine is, it is equally as important that the doctors that are going to be using it be educated in exactly how it works and how to use it, and they not have to worry about laws or regulations that might prevent them from doing so. So that actually became another area of focus for me. That ultimately led to the creation of a nonprofit called the Veterinary Cannabis Society. And what we do is we educate veterinarians and pet owners on the appropriate use of medical cannabis. And we also work with legislators and regulatory bodies to help them create common sense regulation that will allow veterinarians to do our jobs and to keep our patients safe. So that's really what I do. I've grown also into doing cannabis formulations. I now work with a group in the UK called Pet Pharma. And what we are doing is we are creating what will ultimately be the first approved cannabis formulations for animals in the UK and the EU. Because unfortunately, your regulations over there are a bit more strict than they are here in the US. And because of that, the veterinary community has been very hesitant to use these things. So we're working through appropriate channels to get that research done, to make sure that the regulations get changed, so veterinarians not only can feel comfortable using these medications, but will also have access, and will also have access to the educational material they need to know exactly what to do and how to do it.
Thank you, Gary. I think it's very important everything you are doing in this field, because also from our side, from the side of Cannabis Scienza, we completely agree that education drives the adoption. So make a good education in the field of medical cannabis, both in the veterinary or human sides. It's completely necessary to make this field develop in the future.
I agree.
So now let's move from USA to UK, and please, Heidi, can you introduce yourself?
Sure, absolutely. Well, thank you so much for having me again. I absolutely love the Cannabis Essential LinkedIn Lives. I find them to be extremely helpful, and it's an honor to be here next to Gary Richter. It's very hard to follow his intro, but what I will say is that I've been active in cannabis for the past 7 years, and as a previous in the USA, I was a veterinary technician and an animal health professional. It has always made sense to me to include looking at animal health as an option for cannabis medicines and cannabis products for wellness. That has not been able to be conducted here in the UK legally. And for many years being here, going up against the veterinary medicines director, trying to figure out a way to get to market has been very challenging. I was approached by the Pet Pharmaceuticals UK group to be an advisor, but my current role is a global strategist for Swiss Cannivations, where we also are massive animal lovers. We're based in Zurich. I'm here in the UK, and part of our drive within our core entity as well matches with my personal drive to help animals as well as humans. The pet pharmaceutical groups, like Gary said, are finding these appropriate channels and developed the closest thing that I have seen to be able to go to market, to change the prescribing culture, to action the research to then get approved and therefore be able to have the prescribing cascade not only include typical pharmaceutical medicine, Western medicine, but also like Gary is doing in the US. We can look at his work as an integrative health professional for animals to possibly be replicated over here. In addition to what Gary said, back this, the education is completely needed. This is a very nascent market, and in order to do it appropriately, it's to make sure that the education is being taught by peers that understand the use of cannabis and applied therapies. So it is an honor to be a part of this as an advisor, to be, around the greatness of the Veterinary Cannabis Society and Gary and some other amazing veterinarians that are across the globe. It's a true honor, and I'm happy to be involved.
Thank you, Heidi. So now let's go more in depth on the use of medical cannabis in veterinary medicine. So Gary, what are the potential benefits and therapeutic application of medical cannabis for animals? Can you provide us some examples, specific condition or symptoms where you see promising results when using medical cannabis? And if you use more the THC or the CBD or both in your clinical work?
Sure, of course. So, when we look at how medical cannabis can benefit animals, and needless to say, it's all in exactly the same way that it can benefit people. And if you understand the way that the endocannabinoid system works, effectively what it's doing is it's creating balance in the body. So when things are out of balance, whether there's inflammation, there's pain, there's other problems in the body, the whole purpose of the endocannabinoid system is to restore balance. And that's really the place that I think it's most beneficial to look when you start to think about how to use cannabis. But to your question, how do I use it? How have I found it to be most beneficial? Probably the single biggest application that I have found in practice is in the use of pain and inflammation. So whether or not that is a patient that has arthritis related pain, or they have back related pain, or maybe they have pain associated with another condition, cancer, what have you, cannabis has multiple avenues of action on how it can address pain, ranging from being an anti-inflammatory to affecting the opioid system within the body, to affecting other non-opioid receptors such as TRPV1 receptors. There are so many potential mechanisms that cannabis can be beneficial for pain. And the nice thing about it is it doesn't have the potential side effects excuse me, that non-steroidal anti-inflammatories do. It's not going to have negative impacts on the liver. It's not going to have negative impacts on the kidneys. It's not generally going to have negative impacts on the gastrointestinal system. So it can be used in patients that perhaps would not be able to tolerate NSAIDs. But the other nice thing about it is it can also be used in conjunction with NSAIDs for patients that really need it. So it gets along very well with other pharmaceuticals and other herbal therapies. So it's incredibly versatile in that sense. We also, in my practice, we will use cannabis to help animals that have issues with seizures. I found a lot of success in patients with inflammatory bowel disease or other types of gastrointestinal upset. We're even starting to investigate the use of cannabis for things like allergies and other skin-related diseases, because again, that anti-inflammatory effect, has the potential to really be beneficial. So Fabio, to your question of, sort of THC, CBD, what have you, in my practice, I like to use both. And I understand that for some practitioners, THC may be a little bit scary. They may be a little apprehensive. I think the things to remember are that THC, when used in appropriate dosages, and frankly, it's just a matter of calculating a dose just like you would calculate any other drug dose, milligrams per kilogram. It's not anything more difficult than that. THC can be incredibly effective, and you absolutely can put a patient on a certain amount of THC and have them not have any psychoactive effects. I always tell my clients that any kind of psychoactive effect from THC in an animal is absolutely unacceptable as a side effect. This is not what we're after. But just like a person, an average adult person could take 5 milligrams of THC and feel nothing psychoactive wise, but it can still make a huge difference in their level of pain and inflammation. So that's a dosage range that we can sort of work within and help these patients be comfortable. That said, you do not have to use THC in order for cannabis to be effective. If somebody is more comfortable not using it, or if where that veterinarian practices, it's just a legal issue, CBD and other cannabinoids and other terpenes that are present in cannabis can be enormously effective without the presence of THC. It's not a situation where THC has to be present. The only time where I would say there may be an exception to that is when we're talking about animals with severe pain, usually like cancer pain or severe back pain. Sometimes you just need something a little stronger like THC to address that. But if that's not available to you, then that's where you reach to the pharmaceuticals along with the CBD. Again, this all kind of gets along together very, very well. So there's just enormous versatility here. And as you know, cannabis is not a one-dimensional thing. I mean, there are so many active compounds within cannabis. THC, CBD, CBG, the various cannabinoid acids, all of the terpenes. So like, to say that you're going to put an animal on cannabis is actually a really broad statement. It very much depends on what's in the formulation. And that's why I'm working with Pet Pharma, is to create very specific and very repeatable formulations that are designed to be optimally effective for specific medical conditions. In our case, probably the first one that we're going to look at is going to be pain and inflammation, because that's such a big issue in veterinary medicine, particularly animals with osteoarthritis or other sources of pain. So really, it's very much a process of finding a formulation that is effectively tailored to manage a very, very specific medical condition.
Yeah, thank you, Gary. From what you say, I think the problem and also the solution that cannabis have for humans are the same that in the field of veterinary medicine, because also in human, the most used application are pain, basically, seizures, GI problem, also mood disorders, because I read some papers about mood disorder when usually the use of CBD is more seen in literature, maybe also from because of a regulatory aspect. It's easier to research with the CBD than the THC. But on this point, I would like to ask Heidi if she knows what is the point where research is in this field. I mean, what are some of the key findings or development in the field of veterinary medicine, but that we can find in scientific literature?
Well, to be honest, Fabio, there's a load of research that has been conducted going back many, many years, and part of the reason why the UK is so behind is that we haven't had research done here in the UK that is being acknowledged. The most important thing to understand is that there have been findings, conclusive evidence that pain has been reduced, that epileptic seizures or any type of neurological dysfunction has been reduced and or exterminated from the dog's ailments. There has been showings in horses, for instance, where I'm an equestrian and I have a horse who's 31 years old that has no sign of arthritis because of the use of cannabis. Later, he was once on bute every single day because of the pain that he was experiencing. So I think there's a lot of research, real world as well as clinical, that is out there. And if veterinarians are interested in learning about it, that's where they can lean on, like the Veterinary Cannabis Society and groups that are collecting this information and collecting this understanding so that they can possibly bring it to their regions to start spreading the good word of the education that it does exist. For the UK, the reason why Pet Pharma is so important is to show the safety and efficacy can be replicated in a product that could be prescribed as part of the cascade here. But as a general overview, there is evidence. If you name the ailment, there's probably something that has a related cannabis effect that has been positive. And from my recent work in Latin America with some of the other veterinarians I worked with, there have been studies also showing an extreme dosage of THC provided to animals, and there was no fatalities. So the loading dose never created a fatality, and I think that's something to be understood too. You know, when for humans or for animals, if you are taking cannabis alongside maybe other drugs or have other predispositions or have other health ailments where there could be a complexity, that can happen. But if you're looking at the chances of that, I think they're less than what people realize, and I think that's why the research needs to continue. And here in the UK, have it, despite my accent, I am here, and to have it on this soil is so important, so that we can change how animals are treated. There's a need, people are asking for it, yet there is not an ability, but that's what we're hoping to change together.
Thank you, Heidi. I have another question for you, just because you are in Europe and you know most of our audience is based in Europe. What are the legal and regulatory challenges associated with the use of medical cannabis in veterinary practice? What is the current situation? Is there anything that is changing in the last few years or months?
Well, right now it's technically illegal, but however, there are a lot of veterinarians taking it into their own hands because they know that this is a solution. So if they're practicing on their own and taking the ability to prescribe, which they can do, you can prescribe human cannabis oil or CBD oil for pets if you're a veterinarian, but there needs to be a very open-minded doctor that might have done their own research on it versus having some type of criteria to follow from the veterinary medicines director. This is something they're doing on their own. Similarly, there are a lot of people that are taking it into their own hands and looking to buy oil. I get calls, multiple times a week from people looking for relief for their pets that might be on Medicam or Carprofen or something like chronic medicine, and they're trying to get them off of it. And even with the GABA drugs or any of the phenobarbital drugs, people are looking for different types of options so that their pet isn't dulled down or probably losing a bit of their luster for life because they are on such heavy meds for neurological issues. So for veterinary prescribing, it will be the unique veterinarian that takes it into their own hands. For people that are looking for it, there are a plethora and growing, and we need to be able to service them, which is why that brings us back to getting the research done here in the EU, in the UK, that's being conducted, but we need to have an acceptance of that research, but it needs to accompany a duplicable drug, which is what Gary's formulation will be. So that way we can show that we can give the same formulation to the same pet and have a conclusive positive result, and that is what we're aiming to do.
Yeah, I completely agree with you. Especially when we talk about CBD products, there is a large amount on the markets in Europe, in each states in Europe, but we don't know really what is inside. So there may be some problem to make a good calculation also of the dosage, as Gary was saying. But also there is the problem of contamination. For example, there are no controls on this kind or not so many controls on this kind of substances. So it's better always considering to talk with a veterinary before considering medical cannabis, CBD, or products for animals. Now I have a curiosity. When we talk about medical cannabis, are there any differences between pets, like dogs and cats, or farm animals? Because here in Europe, a kind of regulation is trying to understand which is these differences and which are the products that can be given to pets and which to farm animals. I don't know if you want to answer.
Yeah, I think I can address that. So to speak to differences between dogs and cats, I think the biggest difference that we see is the research would indicate that that dogs have a much greater number of CB1 receptors in their brainstem than other species do, and then the sort of the practical reality of that is they are actually a bit more sensitive to intoxication from THC than other animals, and including people, would be. So what that means is that dogs actually will develop a very specific type of syndrome, if you will, from THC intoxication called static ataxia. And it's a very particular set of symptoms that you will see. Now, generally speaking, it is incredibly rare for there to be a fatality related to THC intoxication, but nonetheless, it does require a degree of care when dosing, particularly in dogs. But that said, from an efficacy perspective, it's going to work the same as it is in dogs, as it is in cats, as it is in other animals. We just have to be very cautious with the dosing. Now, to your question about other animals, I think there's really two things to look at when we're talking about larger animals, horses, cows, what have you. One of them is there is not an enormous amount of research from the standpoint of appropriate dosing. The research that is out there would strongly suggest that the dosages in, say, horses would be far, far lower on a milligram per kilogram of body weight basis than they would be in, say, a dog or a cat or a human. And frankly, that's actually very consistent with a lot of other pharmaceuticals as well. On a body weight basis, you wind up frequently using less medication in horses than you would in another animal. But needless to say, more research needs to happen on that front. The other issue, which is not really so much a medical issue when it comes to larger animals, is we have to be very cognizant about anything that's being put into an animal that may ultimately wind up in the food chain. So if we're talking about cows, if we're talking about pigs, and they're being given cannabis as medicines, it's entirely likely that some cannabinoid residue is going to wind up in the meat of those animals. And I think that is a very big concern from a regulatory perspective, and to a certain extent from a human health perspective. To that point, when I have worked with, through the Veterinary Cannabis Society with regulators and legislators in the United States, we are generally focusing on cannabis for companion animals or potentially for horses, because at least in the United States, horses don't generally end up in the food chain. But if we're talking about cattle, that's a very, very serious issue. I mean, there are many, many laws in the U.S., and I'm sure there are in the U.K. and the EU as well, about drug residues winding up in meat. So that's a very, very different landscape that's going to require a much, much longer avenue of research to figure out what is acceptable and what isn't.
Okay, thank you. Just a curiosity, which is the most uncommon animal that you treated with medical cannabis?
Oh, me personally, I mean, I generally focus, in my practice mostly on dogs and cats. But I have colleagues who've treated birds, who've treated reptiles with great success. So it definitely works.
That's great. Thank you.
Thank you. First of all, I wanted to remind everyone following here that if you have a question for any of the two of them, it's these precious last 2 minutes that you could perhaps get a direct live reply from any of them. And also I wanted to remind that I did a kind of a sloppy intro, but yes, not only Gary and Heidi are working in so many different worlds, and of course Heidi's she works at Swiss Cannavisions, but they are also connected through the world of Veterinary, because she's an advisor at Pet Pharma and he's the chief formulator. And I find this really interesting on the perspective of as researchers, myself and Fabio, we have been in this wheel of what we study. Then first of all, who fund this study will indicate what we study on, and this will then predict what we'll eventually recommend to a doctor that then will recommend to his or her patient. But here, what I'm seeing is this beautiful putting the wheel kind of upside down, in which directly who is hearing the needs of the patients, so the veterinarian that is been out there in the field for more than 30 years and knowing and working with this plant and working with different plants as well. So when I when I heard chief formulator, I immediately thought, oh, perhaps he's doing some interesting combination of things because he has the experience of this, and to bring that back into where research. So I'm really fascinated because I believe this is actually how healthcare should be, putting back again at the peak of the mountain of this work, back again the patient with their needs, and then building from there the medication that they need. So thank you for the job you're doing, and thank you for also being really brave of not only working in an environment where perhaps that's more accepted like California, but actually pushing it where it is not easy. So both of you, like, a big thank you from me. And here I see here we have a question from Gillis. What are the side effects of THC overdose in dogs? I think we just covered it, but if you want to give like a longer reply, we can satisfy this curiosity.
Sure. Most of the time, the side effects we would see would be related to THC, which might be sort of mental dullness, loss of balance, ataxia, sometimes vomiting and diarrhea. But like I say, severe symptoms are rare. When we're talking about CBD, side effects are minimal. Sometimes you'll see them look a little bit sedated at higher dosages, but we don't really see much else. Any animal can potentially have gastrointestinal upset to just about anything. So that's always something to look out for. But beyond that, it's quite rare to see any sort of problems.
Oh, you are mute, Viola.
Sorry. Yes, I was saying, I know we're going a little bit above the time, but I will take this question and try to quickly translate it. Basically, what it's saying is, in Europe, it's illegal to administer CBD or cannabinoids as feed or supplement. But for what is concerned as a biomass, so containing cannabinoids naturally, the environment then becomes a sort of gray area. So it's not completely legal, a feed in this sense. And Ruggero, it's reminding us, is another veterinarian that reminds that, yes, last year we published indeed on this topic. The only research that at least we are of knowledge, maybe Gary knows something else done on this topic, that was done on Fabio, was done on sheep, right?
Yeah, on sheep, and the quality of milk improved very much with the use of biomass from cannabis.
Yeah, so
of course without the THC.
I think it's a very interesting topic that, of course, we could go for quite a lot more than this short half an hour, because, of course, on one side there is the whole regulatory to take care of, but it's also important to maybe consider whether we are also taking antibiotics that are given to the animals, and whether that can also have a benefit effect somehow for the animal that is used in feed. So perhaps it's not necessarily something that, even though is passed through, is not beneficial for the human consumption. But it's food for thought, and I find it interesting, since it's someone that it's very, very accurate actually in this topic. So thank you for chipping in, Ruggero.
So yeah, I think we can close now, because the half an hour is passed by. And so thank you, Gary. Thank you, Heidi, for being with us. It's been really a pleasure.
Thank you very much. Thank you all for following, and we'll meet again on next Tuesday, same time, 5:30 Central European Time. Ciao.
Goodbye, everybody.
Thank you, guys. Have a great day. Bye.
Bye-bye.